Renewed efforts to get Cape Town residents to observe coronavirus protocols are underway. In the past week, the metro has recorded a 73% increase in new COVID-19 cases. About 80% of motorists arrested there last week were also caught driving under the influence of alcohol. Let's get you the latest on the story now. Safety and Security Mayoral Committee member J.P. Smith joins us now live from Cape Town. J.P., good morning. Thanks as always for your time. I mean, it appears that what has happened here is that, when we saw an uptick in infections sort of a few months into the pandemic here in South Africa, when we saw infections rising in places like Gauteng and the like, infections were going down in the Western Cape. And what happened clearly with that decrease in infections was people's guards were let down as well.
I think, yes, people are suffering lockdown fatigue everywhere. Nobody wants to hear about lockdown anymore. When you're now doing loud hailing or you're speaking to people in meetings about lockdown, you're getting a very unfavorable and disinterested response. People are not interested in hearing about it, but we have to make them interested. And I think the strongest way to do that is to explain to them we either over the next week, 2 weeks, do something really dramatic by ourselves to slow down the infection rate. We practice social distancing, we wear our mask, we wash our hands, we behave responsibly, we don't go to liquor establishments at night, to pot taverns and clubs and other stuff, and get infected, or we put national government in a position where they have to return to more onerous lockdown levels at level 3 or 4, where there is no festive season, no beaches, no recreation facilities, no major events, and a very unhappy festive season.
Yeah, I mean, it's either that or we go into 2021, we go into the new year under some form of a lockdown.
I think so, ma'am. That's unfortunately the reality. It's act now, immediately, in the next 10 days, 12 days, or compel national government when the lockdown comes around at 15 December to extend it again, or worse, tighten it up. And not just does that make life unpleasant for everybody, it also has dire economic consequences. We're shedding jobs in this country by the tens of thousands. Every extension of the lockdown renders more people unemployed and more businesses closed. We really cannot afford that. The city is busy with a revitalization and a strategy to re-energize our business. And that is going to be made impossible if the lockdown continues to be extended.
Yeah, I mean, the numbers that I was reading out to our viewers in my introduction to our interview, 73% increase in new COVID-19 cases. That's in Cape Town. Now, we know the Western Cape province is looking to announce some form of stricter regulations. What form might that take in the Cape Metro?
So I'm hoping that it'll largely focus around liquor. Liquor is a major driver. The health report we saw identified alcohol and the late night establishments that sell liquor is a major factor for the distribution of additional infections as places where people go and then do not observe social distancing and become infected. But alcohol, of course, also has the additional complicating factor of filling up our emergency wards with people involved in motor vehicle accidents as drivers or pedestrians, or in other accidents or domestic violence cases or otherwise. The alcohol drives a lot of that, fills up your emergency wards, and we now need our hospital beds potentially to deal with a second wave of infection. Yeah. So the big difference between wave 1 and wave 2 is that wave 2 is unfettered by the lockdown and infections are spreading much faster. So you have an infection rate of 1 to 1.5, which is significantly worse than the 1 to 1 that we saw in the first wave.
Yeah. And that's what countries around the world are telling us, that if a second wave does happen, it often is much worse than the first wave. I mean, Health Minister Dr. Zweli Mkhize was in the Eastern Cape just this week, that province also experiencing a massive surge in infections. We know what that means, particularly for the Western Cape, don't we, JP? That if people are experiencing the upsurge in the Eastern Cape after the festive season, no doubt it's going to travel around the country and to the Western Cape in particular.
Oh, people move around South Africa, but particularly these two provinces have a close kinship. There's a close relationship with people moving back and forth. Many people owning two homes, one in the Western Cape and one in the Eastern Cape, return to the Eastern Cape over the festive season. And that does mean that, unfortunately, the inter-regional infections then are also exacerbated, which is bad news for all concerned. So it might mean that we have to do some kind of control in terms of people being screened on this long distance route or curb long distance travel. And again, for people who are wishing to celebrate their festive seasons out of the city and out of the province, that might impose restrictions. So the answer is act now, voluntarily curb your exposure now, or we may all suffer the consequences collectively with stricter regulations later on.
So you're saying that if stricter regulations, particularly, let's say, in the Cape Metro, if they do come into effect, Cape Town's going to be looking to the next sort of 12 to 14 days, I think we're on the 2nd of December now, until the 15th of December, which is when the current national state of disaster comes to an end and either government reimposes some sort of lockdown or extends the national state of disaster by yet another month. I mean, in the interim, JP, should we not already be looking at those super spreader events like taverns, like nightclubs, even now, even before we get to the 15th of December?
We're already doing so. The provincial government gave a list of identified a range of hotspots in the city and problematic activities, and we've been zooming in on these, getting our enforcement staff out to them. So we are starting to find and deal with establishments. I know because I'm getting the hate mail from them, the great anger from them, because they're saying you're driving us to extinction. We're already at the point where we've sacrificed so much to keep these doors open and to pay staff. Now we really need to start business again. You are killing us, and we're saying we understand, but it's either you or everybody else. You know, it's at this stage we can't allow a massive resurgence of a second wave, end up with level 4 or 5 or level 3 even restrictions. That's enormously damaging. And as such, for instance, we've cancelled all of our major events. Yesterday, the minstrels and the Malay choirs and them announced all their major street marches and stuff, which draw upwards of 100,000 people, were cancelled. We cancelled our festive season lights event, which is really, I think, uninterrupted for a very long time, has now for the first time been cancelled. We've broken it into a series of smaller events in CBDs to attract the feet back into those areas. So we're making sacrifices every day. Big events are being cancelled, and events is a major lifeline for Cape Town. There are 35,000 jobs that depend on the events industry, and those individuals are all suffering. That's bad news for all of us.
Yeah, absolutely. It's that argument, lives over livelihoods. JP, as we end off our interview, your message to people, not only those living in Cape Town, but those who will be traveling to Cape Town over the festive season, how can we all try to have some semblance of a festive season after the horrific year we've all had, but also try and keep responsible?
I think it's the sense that this year has been a really grim year and you want it to end. The problem is that the virus doesn't care. The virus is still with us and infections are still a reality. People are still losing their lives. We've got new staff now showing infections within our city employees. Their lives are important to us. Our frontline staff have to be in contact with the public. Please, I plead with people, just do the responsible thing by yourself now and don't force government, national government to make tougher regulations or the provincial government to make regional regulations, which then makes life extremely difficult for everybody and causes more people to sit in unemployment queues. Act now and act responsibly and act for yourself. We do have a collective responsibility to each other.
Yeah, absolutely. J.P. Smith, thanks very much for that. That message applies, of course, not only to the people in Cape Town, but to all of us around the country. Our frontline staff in particular are tired after months and months at the forefront of fighting the coronavirus.